Welcome to Growing Bremerton Together with Mayor Patty Lent. My special guest today is the new health officer for the Kitsap Public Health District. Her name is Susan Turner. We're going to learn about where she's come from and the things that are going on in our health district to keep us safe and healthy. Stay with me. Welcome to Growing Bremerton Together with Mayor Patty Lent. I have a very special guest and a newcomer to Kitsap County. Susan Turner is the new health officer for Kitsap Public Health District. We're going to learn about her coming to us and all the things that she's going to bring and how she's going to take care of all of our citizens. Welcome.
Thank you very much, Mayor Lent. I really appreciate it. I just love being here.
And you've been here since you started the 1st of December.
Yes. We've been here since November, and we just love the county.
And where have you found a little place to stay on your first arrival?
We're renting a home in Hansville. Very pretty up there. But of course, the whole county is just beautiful, so many places. And so we're taking the time to look around and find the place that's perfect for us.
And you know, we as the health district, we work with Jefferson County and Clallam, so being in Hansville isn't the worst as far as coming into the city or coming into the county. You cover the entire county, so where you live really doesn't matter. You've made it easy for yourself, I think.
Yes.
And in Pensacola, Florida, where you last were living, you said the neighborhood was not unlike Kingston. So tell me a little bit about Florida.
Well, Florida is very different in many ways, but has many of the same public health issues, actually. I worked in Pensacola, Florida, in Escambia County, Florida, which was the furthest west county in Florida, bordered by Alabama and the Gulf of Mexico. And Escambia County forms a peninsula.
Similar.
So it has many miles of coastline, not quite as many as Kitsap County, but quite a few miles of coastline. The economy is very similar. The socio-demographics are very similar, and a lot of the public health issues are very similar. A lot of very sensitive environmental areas. A fairly small, as far as urban areas go, urban area, some suburban, and then mostly, outlying areas are rural, similar to here. You can still see the stars at night, like you can here. In Florida, they don't have the beautiful mountains as we do here. And amazingly, it's the same gardening zone.
It is.
It's the same gardening zone.
You know, when I first learned about gardening, I took Sunset Magazine because they are in California, and they took the entire West Coast, Washington, Oregon, California, and you could learn about what could or could not grow in the area that you lived. So that's something that I didn't know about Florida.
Yes.
And I know that we did, I'm on the board of your health district, and we went on a global search, you might say, to fill the third health officer. And because we've been in operation since 1947 or 49, we've only had 3 other ones. So long term, we expect you to stay just as long as everyone else. So this is really permanent. But
I hope so. I hope you'll let me.
and you did some research about what we were about, our strategies, our long-term planning before you even applied for the job, I understand.
Oh yes, absolutely. When my husband and I decided we wanted to move back to the Northwest, we looked at multiple of the health districts and health departments in the coastal areas. And Kitsap Public Health District really stood out as well, in several ways. I previously had several national colleagues across the nation, some from Washington, all of whom, once they learned of my interest in coming to Washington, mentioned to me that Kitsap Public Health District was one of the top in Washington State.
Nice to hear.
Of course, Dr. Lindquist was here, and so there really was not an opening. And in checking out health departments, though, online, the internet's an amazing thing, it's clear to me that the Kitsap Public Health District in its online presence is very transparent, very customer friendly. A lot of forms and information about processes are online and the status of processes. People can get information so much more easily than many other health departments. And I was so impressed that the Kitsap Public Health District has a 20-year strategic plan. Wonderful, absolutely wonderful. Not a common thing among health departments, honestly. And that's in line with community health priorities and the county strategic plan. That's really awesome. That represented to me a community that really has it together, and a public health district that's valued and plays a huge role and is integral to its community. I was also really impressed that Kitsap County as a whole has so many resources that are targeted at issues that urban populations face, especially, as well as rural populations.
We're in an comprehensive plan update. So all of this year, we being the county as well as all the municipalities, 4 cities, and I think that the health district is going to be very integral as far as keeping people healthy as we plan for growth.
That's amazing, because of course, as you know, land use development and urban and suburban growth all can affect health in positive or negative ways. So that's awesome. I'm really looking forward to that.
You mentioned coming back to the Northwest. So you were raised in Bellevue.
Yes. In 6th grade, my parents brought the family to Bellevue, and so I grew up in the Bellevue school system. That was when it was a much more rural community, actually, suburban and even somewhat rural community back at that time. I know it's changed greatly. And then I went to the University of Washington for my undergraduate and my first graduate degree, and then I moved to Florida.
And so did you finish and have any other education while you were in Florida?
Well, in fact, I went to medical school in Florida and completed my family medicine residency program there, and began working in health departments as part of the National Health Service Corps Loan Repayment Program.
Terrific.
So I'm a member of the National Health Service Corps. And while I was in my last position, the last 10 years, I was fortunate to attend an online Master of Public Health program, which happened to be at the University of West Florida in my community. And so it took me 7 years, but I was able to get my Master in Public Health as well.
We know that your credentials superseded you in your applications. So I think that the health district, and I know that the entire county, is very pleased to have you on board. Do you have some ideas that you practiced or that you were doing when you were in your last position that you see a possibility of even enhancing more of what we do?
Sure, absolutely. As we mentioned early on in this conversation, a lot of issues are very similar in public health between the two areas. There are always challenges related to growth and protection of the environment and of people from the results of that growth. It's a stress on the infrastructure, which can pose a public health risk. And I know that the Public Health District has started becoming much more involved in land use development, land use and development, and health impact assessments and so forth. And we were just starting to do those in Escambia County, Florida. And so I'm really looking forward to participating in that here. That's very exciting, kind of groundbreaking work. The kind of health in all policies kind of work is really terrific. So I'm really looking forward to that. You have a great community process here. The Kitsap County Health Prioritization Process that's now in its second cycle. Yes. And I'm looking very much to participating in that. Escambia County had a bit of a process as well that aligned well with their strategic plan, and I see the same is true here. And there are many more.
You know, there are some fun things that the health district has kind of catapulted. One is 5210. And so we started that program in the 3rd grade of the Bremerton School District, and 5 fruits and vegetables a day, for less than 2 hours of screen time when you're not doing schoolwork, 1 hour of activity, didn't say exercise, but the zero sugary drink was the hardest thing for kids. That's something that we've embraced in the district, and that's something that all of our schools now are a part of, as well as the YMCA.
So exciting.
And then through the YMCA, all the third graders in our Bremerton School District get free swimming lessons. And with our shoreline and the water, drowning being one of the top reasons for children's death, we thought swimming lessons would be a wonderful thing. So the city participates, the school district participates, and of course the YMCA. What's nice is that the little kids that might have been truant, they say, "Mom, I have to go to school. We have swimming on Friday." And it's helped in their self-confidence. As you talked about social economic situations, we have a lot of children that live in families of a lower income bracket, and some haven't seen an indoor pool. We have scholarships for them to have swimsuits, swimming caps, but they learn to float, they learn to swim, some want to race, they help others. It's been a marvelous program, and we're in our third year this year.
What a terrific effort.
So those are the fun things that I think you'll find that the community helps participate in. And just as you're moving, Ebola comes out. And it's a whole new thing, and it's a little bit scary. Tell us how we're addressing that here in the county, and your thoughts.
All right. Well, as you know, the likelihood of actual Ebola infection affecting us is very low, fortunately. In fact, our risk of influenza is higher, and maybe we'll get back to that later in the discussion, but as it's flu season. But the health district is taking it very seriously, of course, as are public health jurisdictions all across the United States. In fact, yesterday we had a small internal tabletop exercise in which we stressed our ability to accept reports of notifiable conditions. You know, we receive all the reports of notifiable conditions that could affect the public's health, outbreaks, infectious diseases that can spread, pertussis, sexually transmitted infections. You know, in this particular case, we picked a foodborne outbreak, and we stressed our ability with our level of staffing to handle this foodborne outbreak and the normal reportable diseases. And then on top of that, have some individuals come back from, I think we chose Sierra Leone, healthcare workers that had provided care to patients affected with Ebola in Sierra Leone. And we talked about what our roles would be in terms of making contact with those individuals. We would hear about that through the Department of Health, of course, and we would then make in-person contact with those individuals. Remember, these are not sick individuals.
Right.
These are just individuals who may be at risk of developing infection. And then we would be visiting those individuals as fairly high-risk individuals for developing sickness twice a day. And so we had 5 in our scenario, which took multiple individuals to travel to their homes. They were spread throughout the county, which was going to require some travel time. So I guess I say all that just to say that we are continuing to think of ways that we might stress our capabilities so that we can practice in advance and be ready.
That's amazing. It's like fire drills or earthquake drills. And one of the things that you mentioned, if there was a rumor, and you know how fast a rumor can spread, oh, someone in Federal Way has Ebola, or somebody in Kitsap. What's the first thing that a citizen should do? Should they call a specific number or a line to get the real thing that's going on?
They can call the Public Health District at any time. And I am so sorry I have not learned that number yet.
It'll be on our screen.
Okay, great.
We're going to have your website and the phone contacts.
Great.
So that as we learn about things that are going on in our communities, they'll have a contact for you.
Great.
They may not talk to Sue specifically because she does have a wonderful staff.
Yes.
And you mentioned flu. It's the flu season. Kids are out of school. And some people say it's the wrong strain of immunization. I'm not going to get a shot. What's your advice?
Well,
get the shot.
The flu season is getting to be more flu season, it's getting to be more like flu season every day. We've heard of several long-term care facilities that have had some influenza outbreaks that are working to preventively treat their residents. And we've just learned from Harrison, as a matter of fact, this morning that they are seeing more admissions to the hospital from influenza than they have been seeing.
Right.
And so we know flu season really is here, and we really do advise people to get their flu shot. It takes about 2 weeks for the flu shot to become active, but we are just launching into flu season, so it still has plenty of time to be protective.
What are the most vulnerable age groups that really should get the flu shot first, or not ever say, well, I don't need it? There's an age group that is more vulnerable.
Yes, and for the strain that seems to be circulating during this part of flu season anyway, it seems to be the more traditional groups, the very small, less than 5, and the the elderly, not necessarily the very elderly, actually probably 60 and above are vulnerable. Yeah. That's what we're seeing, and that's what I hear from other health officers that they're seeing as well. It is true that what people have heard, that the influenza strain that is most going around, the H3N2 they call it, to be technical, has varied a little bit. The virus itself has changed itself a little bit, and so the flu vaccination might be a little bit less effective, but it most certainly is expected to have cross-reactivity with this virus, making illness much less likely to be severe, especially in those with complications. And that's the particular strain that's circulating now. Near the end of flu season, there may actually be other strains that are circulating that are better covered in the flu vaccination. So we are really, really encouraging that.
Besides the flu shot, I know you say that if you have symptoms, call your doctor. And if you have asthma, if there's anything that might contribute to you getting sick, and it spreads so fast, and that's what's wrong with flu. Another thing, as these strains come back and forth, I've heard, and please verify this, if a doctor prescribes that you take these tablets for 10 days, and after 6 or 7 days you say, you know, I feel great, and you stop taking them, is that a risk? Is there a reason that you have a certain length of time to take a prescription for what you have? Because the strain says, well, now if you didn't take all of it, you're going to be susceptible to another strain. Is that true, or is that just a rumor?
No, actually it's true, and actually the physician generally prescribes it for a certain length of time for a couple of reasons: to adequately treat the bacteria or virus. There are antibacterials, as you know, as well as antivirals.
Yes.
So it's generally to make sure that you are cured of it. In the case of antivirals, your physician wants to make sure that you're cured of the flu, or in the case of preventive treatment, the flu is prevented in you for an adequate period of time, so you're not wasting your time in taking it. And then finally, if an antiviral or an antibacterial is stopped too soon, so that you're not actually cured, then that particular virus or bacteria that's still around may have developed characteristics that are less susceptible to that antiviral or antibacterial, and if you spread it to somebody else, they're not going to be too helped by the antiviral or antibacterial.
So you say, take your medicine.
Finish it, please. Yes. And of course, with influenza, there's much more and equally important steps. There are many more and equally important steps people can take to getting a flu vaccine. And you said the most important, which is if they get sick, stay home.
Yes.
So that they don't expose other individuals. With influenza, unfortunately, you're sick for about 24 hours before you feel it. But nonetheless, when people feel ill, they need to stay home. They need not to come to work and expose their coworkers. School children need to stay home so they don't expose their schoolmates. And when people cough, they need to be very careful to cough in a protected place.
Our kids do it better than our adults do it.
I see the kids doing it all the time, yes. Or use a tissue that gets thrown away. And all of us really during this season, influenza is not the only thing going around, as you know. Cold viruses and respiratory syncytial virus, which affects, again, the very old and the very young. are going around right now, and the very best prevention is washing our hands frequently, and especially before touching our nose, eyes, mouth, which is very difficult because we're wont to do that.
That's true.
Yes.
You know, you have a unique position as health officer. We have a naval hospital. You work with doctors throughout the community. You work with the schools, the school nurses, a variety. And we also, because we're one of 14 states that are registering people that have not been insured or are changing insurance, and that's part of your responsibility here in Kitsap. So can you cover just a little bit about that program?
Yes, we are very fortunate to have that program. I was not fortunate to experience that in Florida. And I have heard directly from the staff that it is just a joy for them to work with these individuals who have never had access to insurance before. All of us who sign up for insurance, I think I can speak for others. I find it, I know, very intimidating myself, and I'm very experienced with insurance over the years. These individuals have not experienced insurance previously. There are a lot of things for them to read and understand about their responsibilities and ways to navigate the health system so that their insurance will cover their services that they receive. And so our program is a wonderful kind of lifeline to those individuals who wouldn't otherwise have coverage to get prenatal care, to get the preventive immunizations in childhood are not too much of an issue because the health district is able to cover those. But there are so many more health services and preventive health services that are not covered unless someone has insurance. I think I heard our in-person assisters say that many of those they're providing special help to are individuals who have difficulty with English, because of course it's especially difficult. It's difficult anyway to navigate a system you've never participated in, the insurance and then the follow-on health care.
Right.
But when one is having difficulty with English as well, it's just, it layers on more deeply for them and makes it more difficult.
And you have a fluent Spanish-speaking employee.
We do, and she just loves her work.
That's great. I do know that at the last health meeting she was talking about, it took 3 to 4 hours to go through that registration and process. Now it's down to about 15 minutes. And once someone has come into the health district, registered, and they're covered, the first thing is they have a card, and if something happens and they don't know how to access the card or the doctor, you help them in that capacity. So we're going to have a very healthy community citizenry, and I think that's exciting. That's exciting for you as a leader and the leadership that you have in this.
Absolutely. It improves the health care access, which, as you know, is an important part of the picture.
Right. In addition, you also inspect restaurants, you have environmental health care where the sewer systems, you have all kinds of things that take place in Kitsap County. And our audience may not know that you have different divisions that really make them safe. And again, that phone contact, if they have any questions at all, they can get answers, whether they're moving, whether they have a backup in their sewer, whatever, well, they'd call the city for that. But there are things that you are responsible for. Is there a big difference between health and health care? And what's the correlation that you see that best defines what our citizens need?
The research shows that health is about much more than health care. Health care is critical, especially in preventive arenas like prenatal health care, early childhood health care, immunizations, and so forth. However, the research shows that only about 10% of our individual health is determined by our health care. That's kind of shocking because we think about health as being equivalent to health care. Genetics is felt to be responsible for about another 10% of our health situation. So that leaves about 80% of our health that's determined by other things. They're actually things that we can do something about, although many of them pose difficult community questions and require community solutions. So those other things are like healthy lifestyle choices. You talked about some when you talked about 5210.
Yes.
Avoiding cigarette smoke and cigarette smoke exposure, tobacco and nicotine exposure now that e-cigarettes are around.
Right.
Making safe sex choices, making, well, simply washing your hands, that's a health behavior as well. Things that are more difficult community issues are things about the built environment, making sure there are safe places where people can buy healthy food and participate in that 1 hour of physical activity a day. Making the easiest, the most healthy choices the easiest. And making sure that the culture around people supports their healthy choices. And then the really hard things like poverty,
Homelessness.
Lack of access to housing, lack of education, race and ethnicity still make a difference in someone's health. And those are very complex community problems that the K-CHIP process is beginning to address. They're very difficult, and they take a whole community to address those problems.
Two things I want our audience to know before we close today, and that is you have nurses that go out for the first time you have a baby, and they want to make sure that as they come in and they assist you with getting a doctor on board or knowing where you can get resources, they also see how the household is so they can make recommendations for the healthy choices. I think that's important. The second is ACEs. We find that young children, if they have had neglect or abuse or whatever it is that goes on in a family, and because of just circumstances, that affects them their whole life. So we're concentrating as a health district on the whole being, and we want to start with that infant, that little child before it starts kindergarten, all the way through when they're seniors and maybe in a retirement situation. So you have your work cut out. I know that you are passionate about what you do.
Very much.
Her husband's name is Mike, and they have a cat named Zorro.
Yes.
And so they've already embraced our community. You
Yes.
said he stands up and he paddle boards.
Yes.
They're taking advantage of our water trails, and I think we are going to embrace you in the community.
Thank you.
I look forward personally as the mayor to work with you in all the great things that Kitsap County is going to be to the city of Bremerton. Sue, thank you for being my guest today.
Thank you very much. I'm very honored.
And thank you for staying with us. I'll see you next time.